All right, so this is my audience. Physician-assisted death refers to the practice in which a physician provides a potentially lethal medication to a terminally ill, suffering patient at his request that he can take at a time of his own choosing in his life. My name is Jacob Humes, and I will be discussing physician-assisted death. This procedure should be enabled because there are strict rules and regulations that must be followed and met for this treatment to be available. There is a law that many patients fall under, and there is a likely chance that these patients, if the PAD is not available, may commit suicide in a traumatic way. Many people, if not everyone, have experienced a difficult loss of a loved one due to a tragic, untreatable condition like cancer. I believe terminally ill patients should have the right to physician-assisted death because there are very strict rules, guidelines, and regulations for this treatment to be available to an individual. A PAD is only available to individuals who have terminally ill diseases or are believed to have 6 months to live or less by a doctor. These patients are ones who have been through extremely challenging times when it comes to failed treatments and medications and providing the proper relief. These individuals end up in a state where they are suffering more than they are living. Terminally ill patients who spend their days trying to manage pain rather than enjoying what they can with the rest of their time on earth are in a place where they should have the right to a physician-assisted death. I don't believe that every patient will take this option. I also don't believe that every patient should take this option, but they should at least have the choice. According to Peter Jarrett, the author of the article, Physician-Assisted Suicide, it is ethical. There are strict qualifications that must be met for this treatment to be an option for a patient. Patients must be terminally ill with a disease that allows them to physically take the medication by themselves, and their mental capacity must be stable enough for them to know and be aware of what they are requesting. When it comes to requesting this treatment, individuals must have asked the physician verbally twice within 15 days of each other, at least 2 witnesses and a written request. On the doctor's end, 2 doctors must sign off on this treatment, approving that the patient is an individual who qualifies. It is only valid if the request process has been followed properly. The doctors must be the lead doctor on the case, and a consulting doctor must also be present as well. That is the process that must be followed in order to follow the rules of achieving a PAD. Although most states do not allow physician-assisted death, some have passed rules regarding this treatment that are known as the Death with Dignity Acts. The Death with Dignity Act states the following. The law specifically states that the termination of one's life under the law is technically not suicide, since the patient is already facing certain death. There are several safeguards in place to ensure that the patient is mentally capable to make such an important decision, including the opportunity to withdraw the request at the last minute. These states that have passed the laws, the Death with Dignity Acts, follow the idea and the value that the human life is respected and the patients who are facing death are also respected. The patient feels as though the person they were before the illness will be forgotten. Dying patients sometimes lose all ability to take care of themselves. Vomit, drool, urine, feces, and other indignities must be attended to by nursing assistants. Alzheimer's patients suffer from progressively worse dementia that causes memory loss and incoherent rambling. It is difficult enough on an individual with a life-altering disease to watch themselves diminish in health. The last instance they want is their family and friends to solely focus on their declining health after the individual has passed. Finally, if physician-assisted death is continued to be illegal in most states, the chances of a horrible and traumatic suicide of these terminally ill patients will rise. These patients commonly don't want the healthy life they lived before to be masked by their illness. Lying in our hospitals today are people afflicted with excruciatingly painful and terminal conditions and diseases that have left them permanently incapable of functioning in any dignified human fashion. They can only look forward to lives filled with yet more suffering, degradation, and deterioration. Since the right to PAD is non-existent in most states, it is not uncommon for these individuals to undergo a traumatic, suicide, or even homicide. There was a skin cancer patient who had an incident that happened that could have been prevented if PAD was legal in the state in which he resided. According to Santa Clara University, there was a man who suffered from skin cancer that had resulted in the loss of his nose, left hand, 2 fingers on his right hand, and a portion of his jaw. On top of all these traumatic losses, the man was also blind. And only deteriorating. Day after day, he begged to be put out of his misery because he could not handle the amount of pain he was in. He was expected to live only 1 more year. His plea to be taken out of his misery could not be acknowledged, and he laid in bed with his teeth clenching in suffering pain. Finally, his brother couldn't take this happen anymore. He came to the hospital with a pistol and he shot his brother to relieve him from the suffering. The brother was tried for murder. I believe physician-assisted death should be legal for terminally ill patients who qualify because the guidelines and rules are very strict to ensure that the human life is well respected. Terminally ill patients should have the right to be able to decide if they want the PAD or not. How would you or did you feel watching your loved one suffer from a sickness that you knew they would never recover from? I think this topic is something that we can all relate to, and we must remember it is not about what we want, it is what your loved one would want.